Hey guys, so today I want to make a video about ZOLOFT antidepressants, the side effects of it. I want to bring light on all these dangerous side effects, and the list is very long. And the source of this information I will bring to you now is from the Danish drug page, min.medicin.dk. So listen here if you are taking ZOLOFT. Many of the side effects usually occur only at the beginning of treatment. The very common side effects, more than 10 out of 100% get the side effect diarrhea, nausea, dry mouth, dizziness, fatigue, headache, drowsiness, insomnia, missing or delayed ejaculation. Ordinary side effects, a maximum of 10 out of 100% get the side effect. Ringing in the ears, visual disturbances, indigestion, constipation, air from the intestines, stomach pain, vomiting, taste disorders, teeth cut against each other, fever, weakness, discomfort, increased risk of accidents, respiratory tract infection, weight gain, decreased or increased appetite, joint pain, muscle pain, back pain, increased muscle tension, movement disorders, shaking, change in the skin sense of touch, anxiety, depression, difficulty concentrating, nightmares, nervousness, unrest and restlessness, unreality or alienation from one's own person, appearances, or parts of one's body, menstrual disorders, decreased sex drive, erection problems, yawning, sore throat, hay fever, chest pain, skin rash, increasing sweat, hot flashes. Not common side effect, no more than 1 in 100% get the side effect. Tendency to bleed, cardiac effects, ear pain, decrease metabolism, bleeding from the gastrointestinal tract, holes in the teeth, disease in the tongue, allergic reactions, seasonal, swelling around the eyes, hypersensitivity, fluid retention in the face, cramps, joint inflammation, muscle cramps, muscle weakness, tumors, gut disorders, memory difficulty, coordination disorder, migraine, impaired sensation, aggression, hallucinations, acceleration, psychosis, suicidal thoughts or suicidal behavior, drowsiness, difficulty speaking, thought disorders, blood in the urine, lack of urination, involuntary urination, vaginal bleeding, sexual disorders, difficulty urinating, muscle contraction in the trachea, shortness of breath, inflammation of the skin, hair loss, small hemorrhages in the skin and mucous membranes, fainting attacks, high blood pressure, fluid retention in example arms and legs. Rare side effects, a maximum of 1 in 1,000% get the side effect. Inflammation of lymph nodes, increased risk of infection due to lack of white blood cells, increased tendency to bleed due to decrease in the number of platelets, blood clot in the heart, palpitations, slow pulse, increased amount of the hormone prolactin in the blood, bleeding in the eye, double vision, different pupil sizes, cataracts, inflammation of the pancreas, inflammation of the lower body, the lower part of the colon, hemia, mouth inflammation, addiction to the drug, malignant neuroleptic syndrome, severe condition with IA fever and blurry of consciousness, hepatic impairment including hepatitis, jaundice, and dysfunction of the liver, allergy, swelling of the face as well as the oral cavity and larynx, anaphylactic shock, an acute severe allergic condition, Serotonin Syndrome, effect of on ECG including prolonged QT interval, diabetes, too little sodium in the blood, too much cholesterol in the blood, high blood pressure, low blood sugar, degradation of muscle tissue, increased risk of bone fractures. Coma, motor agitation, involuntary jerky movements, increased sense of touch, disturbances in the connection between identity and memory or sensory experiences and cognition, suicidal thoughts, decreased urine production, inflammation in and around the vagina, inflammation like skin reactions on the penis, prolonged painful erection, development of breast in men, breathing problems, lung disease, decreased breathing, contractions in the laryngeal muscles, severe skin reactions, inflammation of the hair follicles, skin rash with blistering, hypersensitivity to sunlight, local anemia in example arms and legs, contractions of blood vessels in the brain. And the unknown side effect is visual impact, inflammation of the colon, persistent cramping in the masticatory muscle, and bleeding after birth. And bleeding after birth, there is an increased risk of postpartum hemorrhages, has been seen with treatment within 1 month before birth with SSRIs and SNRIs. Prolonged QT interval is a special type of disturbance of the heart rhythm, which in some cases can lead to sudden death. Decreased sodium levels in the blood can be seen especially in the elderly. Serotonin Syndrome, including fever, stiffness, tremor, muscle cramps, and alerted mental state, and malignant neuroleptic syndrome, including muscle stiffness, involuntary movement of the arms and legs, tremors, confusion, speech and swallowing difficulties, high fever, unstable blood pressure, has occurred using SSRIs. Both conditions can be serious and require medical attention. The risk is increased by concomitant use of the number of other drugs, including other drugs for depression, certain drugs for migraines, and drugs for psychosis. There have been some cases where side effects related to sexual disorders like impotence, decreased sex drive, have persisted after treatment with SSRIs or SNRI has stopped. Certain side effects, such as fatigue, and sleep disturbances can be difficult to distinguish from the disease itself. And special warnings: possible increased risk of suicidal thoughts or suicidal behavior at the start of the treatment, especially in adolescents under 25 years of age. In the first weeks of treatment and in cases of changes in dose, you must be aware of signs of possible suicidal thoughts or suicidal behavior in everyone, especially in case of symptoms of anxiety or if there have been cases of suicidal behavior in the past. In children and adolescents under the age of 18, there is increased risk of both suicidal behavior and aggression. The drug should only be used for children and adolescents under 18 years of age. In obsessive compulsive disorder (OCD), and the treatment should be handled by a specialist in child and adolescent psychiatry. In the long-term treatment of children, physical and mental development should be monitored regularly. In addition, special attention should be paid to signs of suicidal behavior. In case of anxiety, the anxiety may temporarily get worse at the beginning of the treatment. In schizophrenia, the psychotic symptoms may worsen. In the long-term treatment of children, physical and mental development should be monitored regularly. The products should be used with caution. In cataracts, poorly functioning liver should be completely avoided in case of very poorly functioning liver. Mania, increased tendency to bleed, increased risk of decreased sodium content in the blood. In case of signs of mania or seizures, treatment should be stopped. SSRIs type antidepressants may reduce bone mass and thus increase the risk of bone fractures. However, reduction in bone mass has also been seen in untreated depression. Risk of affecting blood sugar if you suffer from diabetes. The drug should be used with caution if there is an increased risk of developing prolonged QT interval, a special type of arrhythmia in the heart. This applies, for example, to too little potassium in the blood, slow heart rate, various heart diseases. Use of other medication while you are taking ZOLOFT, then it's very important to consult with your doctor about it and tell your doctor about it. ZOLOFT must not be taken if you are being treated with pimoside, antipsychotic, MAO inhibitors, antidepressants, Parkinson's disease or infection medication, or if you have been treated with isocarboxyl and MAO before the last 14 days inhibitor. Concomitant use of certain other antidepressants, other SSRIs and SNRIs, certain painkillers, tramadol, fentanyl, certain anti-ADHD, amphetamine, and certain anti-migraine drugs, triptans, may increase the risk of Serotonin Syndrome. A number of other agents may increase or decrease the effect of ZOLOFT. This includes certain anti-infective drugs, certain antifungal drugs, certain anti-hive drugs, and certain cardiovascular drugs. There is a risk of an increased tendency to bleed if you are also taking medicine that can affect the blood's ability to coagulate. Use of other medication while you are taking ZOLOFT, then it's very important to consult with your doctor about it and tell your doctor about it. ZOLOFT must not be taken if you are being treated with pimoside, antipsychotic, MAO inhibitors, antidepressants, Parkinson's disease or infection medication, or if you have been treated with isocarboxyl and MAO before the last 14 days inhibitor. Concomitant use of certain other antidepressants, other SSRIs and SNRIs, certain painkillers, tramadol, fentanyl, certain anti-ADHD, amphetamine, and certain anti-migraine drugs, triptans, may increase the risk of serotonin syndrome. A number of other agents may increase or decrease the effect of ZOLOFT. This includes certain anti-infective drugs, certain antifungal drugs, certain anti-hive drugs, and certain cardiovascular drugs. There is a risk of an increased tendency to bleed if you are also taking medicine that can affect the blood's ability to coagulate, like NSAIDs for pain. Especially at high doses, sertraline can increase the effect of the number of other drugs, including certain antidepressants and certain other antidepressants, triglyceride antidepressants. If warfarin blood thinner is taken at the same time, it may be necessary to adjust the dose of warfarin. Concomitant treatment with lithium, medium to moderate, may increase the risk of certain side effects like nausea, restlessness, and sleep disturbances. Herbal medication containing St. John's wort may alter the effect of ZOLOFT. Prolonged by concomitant use of agents that may cause prolonged QT interval, a special form of arrhythmia of the heart. This includes certain remedies for heart rhythm disorders, certain remedies for psychosis, as well as several antibiotic and antidepressants. So this was the list of side effects of ZOLOFT. So this is pretty crazy side effects there is here. It's very dangerous, especially when you think about that it can cause you suicidal thoughts and behavior, or impotence, or problems with sexual part in your life after the treatment has stopped with ZOLOFT.